Hey, it's Scott. And I can guarantee if you have any sort of medical initials after your name, that everyone in your family has your cell phone number. And if you're anything like me, on a regular basis, you're going to get a text, inevitably at 2 o'clock in the morning, saying, "Hi, do you know what this rash is?" And honestly, from personal experience after playing in the ER forever, 99% of the time my answer is simple. You know what? I don't know. And I just simply ask, I'm like, you know what, do they look cute? And they're like, yes. I'm like, great, you know what? You can see your pediatrician tomorrow because they look cute. However, especially in recent years past, that's now changed. And the rationale really comes down to play to the whole idea of immunizations. And as I'm sure many of y'all have seen, there's now a fair amount of people out there now not immunizing their kids. And whether it's for religious or other reasons, we're seeing stuff that we haven't seen in quite a while coming back to play. So that is important because not only from the nurse medic, PA, RT, etc. side, but even from the physician's side, a lot of them haven't seen a lot of these rashes that are now coming back to visit. So with that, I highly recommend that you know 3 rashes. The first of which is chickenpox, otherwise known as... So number 1 is chickenpox, number 2 is meningococcemia. And when you're confronted with meningococcemia, just remember at its essence, big blue blotches that don't blanch are seriously bad. So number 1 is chickenpox, number 2 is meningo, number 3 is measles.
Recently there's been a lot of talk about measles. What does measles actually do, and should you vaccinate against it, or is this just hysteria?
So this comes into play because if you haven't had your shots and you're exposed to somebody that actually has measles, you have a 90% chance of actually catching measles. It's far better odds than you're going to get if you take a weekend trip to Vegas. So this really comes into play because remember in the last couple of years, there's been several outbreaks involving children and big people, both on the West Coast and the East Coast with measles. However, from our perspective, before moving down to Florida for the majority of our career, we worked up in Chicago. And in the last week, at one of the undocumented immigrant areas in downtown Chicago, they now, as of 3 days ago, had 2 children. As of today, they have 5 children that are documented to have measles. And take that one step further, now on the internet, on the radio, and in the newspapers, they are actually putting out call-outs to people saying, if you happen to be at XYZ hospital on this day, between this hour and this hour, you now need to go ahead and get evaluated for exposure to measles. So with that in mind, take that one step further. Let's recently on the internet, when it comes to life down here in Florida, right? Florida is certainly known as the land of sunshine and palm trees. However, more recently on the internet, it's also known as the measles state. Whereas Florida, come for the sunshine, leave with the measles. So when it comes to measles, it's best described as triple C. And triple C can mean a couple different things. First of which is during COVID, you can get COVID, cough and cold. Number 2, if you've got a cold, well then you can take Coricidin, cough and cold. If you happen to be in the military, they have TCCC, otherwise known as their variation of a trauma course. But specifically for measles, remember you get triple C. And when you're playing with measles, first of which you get cough, and that's important because most kids who have a cough have a cough. You get a cold, and most kids who have a cold have a cold. And you get conjunctivitis, otherwise known as pink eye, and most kids who have pink eye. Except if you haven't had your shots. Take that one step further, children with measles can get something called measles mouth. And measles mouth, you remember, is very different than meth mouth. Meth mouth is when you look at them and you're like, ooh, nice tooth. However, specifically when you're dealing with measles, they get something described as Koplik spots. And Koplik spots are described with grains of sand inside of your cheeks. And at first glance, it looks very different than strep throat does. The last thing they get, to no surprise, is the rash. And why this is such a big deal is if you look in the internet, you'll find lots of pictures that look like the measles rash. However, in over 30 years of playing nurse, I have taken care of one, count them, one child who actually had measles. And it's kind of hard to diagnose something you've seen once in greater than 30 years. So when it comes to the rash, the best description I've heard is you take a bucket of rash and you pour it over your head. Meaning it starts at your head and it moves down to your body 2 weeks after exposure. That's huge. Because meningococcemia with big blue blotches that don't blanch, you can actually be dead within 12 to 24 hours after you start to see symptoms. And chicken pox, you're actually contagious 2 days before you start to see the chicken pox. However, measles, 2 weeks before you see the rash. And with that, whether it is chicken pox or meningo or measles, remember, everything bad that happens is respiratory. So when it comes to these kids, specifically for chicken pox and for measles, not only do you get a mask, but they actually recommend you get an N95, just like you would for TB or more recently for COVID. But the moral of the story is when it comes to kids, everything bad that happens is respiratory. So if it looks like anything funky and you don't know what this thing is, mask up.